are major documents that have highlighted things that we as Canadian society need to be doing to advance Indigenous reconciliation. We've previously in the spring heard presentations around the missing, murdered Indigenous women and girls, and some of the recommendations coming under that. That was the UN Declaration of Indigenous UN Indigenous Rights. Sorry. Today's presentation is going to be around the Truth and Reconciliation Commission's recommendations. And so once again, we have Alicia Boston, who's one of our health promoters speaking to us, and Sarah Rice, who is our manager for Indigenous Public Health. So I'll turn it over to them.
Thank you. Welcome, and let's start with your presentation.
Sarah My name is Sarah Rice, and I'm the manager in Indigenous Public Health. Oh, and excuse me, my pronouns are she, her. Good afternoon, my name is Alicia Boston, and I am a member of Sigma Kanishnaabek, and I live in Sudbury, and my pronouns are she, her. I also would like to just note that I'm also the granddaughter of a residential survivor. My grandfather, Peter Jones, went to the Spanish residential school. The content, so the first thing we want to share with you is that this content discussed includes references to residential schools, colonial violence, genocide, and the ongoing impacts of those harms. These are difficult but necessary truths. Facing them is part of the work of reconciliation. As we are reminded with each Unlearning Club, it's important to practice self-care as we continue this journey. So we begin today with the Truth and Reconciliation Commission reports in honor of this month being the National Day for Truth and Reconciliation. These documents capture the survivor voices and live realities of more than 150,000 Indigenous children who were forcibly removed from their families and placed in residential schools, part of a systemic attempt to erase Indigenous identity, languages, and culture. More than 6,750 survivor testimonies were heard. What they told us was clear. This wasn't just plot policy. It was part of a broader colonial strategy. The report refers to it as cultural genocide, but the impacts created a genocidal state. This is not just a historical account. The report also lays out 94 calls to action, which are concrete steps meant to repair harms and dismantle the ongoing systems of inequity. But most importantly, they teach us that reconciliation is not a checkbox or a symbolic gesture. It is an ongoing commitment to truth, justice, and structural change. And we in public health have a critical role to play in that process. The TRC was created as part of the largest class action settlement in Canadian history. Its purpose was to expose the truth of residential schools, but also to show the systems of colonialism before and after them. The reports are not just about reconciliation, but also about government-sanctioned violence, genocide, and long-term health impacts. Residential schools were one part of a much larger colonial puzzle. Truth and Reconciliation Commission didn't publish a single report. It produced a 6-volume record that exposes the full scale of the residential school system and its devastating ongoing impact. These volumes go far beyond the walls of the schools. They reveal a system built to erase Indigenous identity through forced assimilation, family separation, and cultural genocide under the guise of education. The companion report, The Survivors Speak, centers the voices of those who lived through this system. Their testimonies are painful, powerful, acts of truth-telling that bring light to stories long silent. Volume 4, on missing children and unmarked burials, fundamentally shifted the national conversation. It investigated the thousands of children who never came home and directly led to community-led searches like the one that uncovered 215 unmarked graves in Kamloops in 2021. Because these 6 volumes are deeply detailed and academic, The TRC also released more accessible companion documents. What we have learned offers a concise overview of the school's history and legacy. Honoring the Truth, Reconciling the Future summarizes the TRC's key findings and outlines the 9 core calls to action. Together, these reports expose residential schools as part of a much larger colonial project. They don't just document harm, but demand accountability, justice, and change. Reading and responding to these reports isn't just about understanding the history, it's about recognizing why reconciliation remains a responsibility for all of us today, especially in institutions like public health. Residential schools were part of a broader system of assimilation and cultural erasure that included day schools, land displacement, and the 60s. These institutions and policies sought to separate Indigenous children from their families, cultures, and communities. Many children were placed in overcrowded and unsanitary conditions where they were punished for speaking their languages and practicing their traditions. They experienced physical, emotional, and psychological harm. Despite these efforts to suppress Indigenous identity, communities have shown immense strength in cultural survival. The impacts of these policies continue to be felt today: intergenerational trauma and resulting health inequities, but so too is the enduring power of Indigenous languages, cultures, and knowledge systems. The discovery in Kamloops was not new to survivors. They've said for decades that children went missing, unaccounted for, never to return home. This moment forced Canada to open its eyes and to listen, confirm survivor truths, and caused many to realize that the trauma isn't past but present, embedded in the social determinants of health through persistent poverty, health disparities, cultural disconnection, and systemic racism. This was never about just education, but about elimination. The calls to action are not suggestions, but directives. Survivors gave them to us as clear instructions for dismantling the systems that were designed to erase them and for repairing the harm that continues today. They speak to the government, the education system, the justice system, and us in health. Call to Action 18 demands that we close the persistent health gaps between Indigenous and non-Indigenous communities, while Call 22 urges recognition and integration of Indigenous healing practices into our healthcare system. Nearly a decade later, only 13 of the 94 calls to action have been completed. The rest have been delayed, underfunded, and ultimately ignored. These delays are not passive, as they are active, ongoing harms. Every unmet call is a failure to listen, a failure to act, and a failure to honor the truth that survivors courageously share. The Yellow Pen Institute, which is a respected Indigenous-led think tank, stopped tracking calls to action in 2020. Not because the work was done, but because government inaction made the progress meaningless. There is no national timeline for completion. That's why action from local institutions like Public Health Sudbury District is more important than ever. Colonialism is a root cause of the health inequities we see today. The TRC gave our sector a specific mandate to fix this. We must embed cultural safety, collect ethical data, partner with Indigenous-led care systems, and support health sovereignty. This is not an add-on, but central to our mission for creating healthier communities for all. Additionally, we have made a commitment to do this important work. The Learning from the Unlearning Club is the emphasis that language reflects power. The people in residential schools were survivors, not students. The TRC was also not permitted to use the word genocide in the final report. They had to soften it to cultural genocide. But what happened created a genocidal state. Using language like schools or cultural loss minimizes the violence that these systems enforce. As public health, we must model truth telling through our words, because neutral terms or softening the language maintains white supremacy. Naming it breaks that cycle. Change begins with education, and while public health has taken important steps in that direction, Education is only the starting point. For initiatives like the Young Learning Club, we've learned that everyone has a sphere of influence. What we choose to do with that influence matters. Learning must lead to dialogue, and dialogue must lead to transformation in our teams, our programs, policies, and ultimately in the systems and structures that shape health and equity. Reconciliation is not only a collective responsibility, it is also a personal one. The TRC's reports hold difficult truths and essential knowledge that we cannot do justice in our short time with you today. So we encourage you to engage with them because reconciliation belongs to all of us. We are not separate from this history. We are operating in its shadow. That means we have a responsibility and an opportunity to do things differently. Let's ensure our public health unit leads, not just in its words, but in meaningful action. Thank you much.
Thank you both for the presentation. I'll open it up to any questions or comments from directors, whether online or in person. Ali?
Through you, Mr. Chair. So I'm just wondering the calls to action that haven't been commenced yet. What is the delay on that? Is it pushback from governments? But like, where are you? Where are we at getting them started, initiated?
Take that.
I think that it's the will of the government. To be honest, anything that would come out of my mouth right now would be highly critical. I don't think that I think it's okay to be highly critical of the government, but it's also incredibly personal too. So sometimes I hesitate in sharing my opinions about these situations, but it really is the will of the government and thus the will of the Canadian people to ensure that these calls to action are met. Yeah, I just think I think that also we kind of have a bit of power in making it a priority. Do their part.
Thank you. Yeah. Oh, go ahead.
Yeah, so I think what I'm kind of hearing is that we need someone to lead the charge, and that needs to be people who are not Indigenous. Because as leaders, people who don't fall under that should be looking at that and evaluating that. At the city council level, we're just starting an Indigenous advisory panel. I think it's important. It's showing that we care. It's not just lip service with the relationships that we're building with our Indigenous partners around the region as well. And I think that's hoping that it's going to be a way that those conversations can start happening, where at the municipal level, we can then bring it up to a provincial level at the Association of Municipalities of Ontario, and also encourage other municipalities to be leaders in that and advocating for those changes and to get some of those started. So I think it's a good step forward for us as a municipality here, and what we're able to be in charge of, I guess, right? Because there are the different levels of responsibilities, but if we set a good example and lead by example in our level, then we're doing our part. And also just part of the board here and just having those conversations, it's important.
Thank you. And I sense the frustration in your voices. So, like Natalie indicated, I think it's working together, try to address these call to action items and not just pushing sides. Is there any other questions or comments from any other board members, whether online or in person? Hearing and seeing none, thank you both for the presentation. Continue.